Good evening and welcome to the Westport Library's business program, Getting Started in Medicare. My name is Ellen Jampol and I am the business librarian at the Westport Library. This evening, Mark and Curtis Bentley of Health Directions will provide clear, concise, straightforward answers to all your Medicare questions. Curtis Bentley brings a balance of analytical skills and creative problem solving to the Health Directions team. His years of experience helping people understand their options in the ever-changing health insurance industry reassure his clients that they are enrolled in the right plan for their particular stage of life and coverage needs. He is an active member of Westport's BNI. Mark Bentley is proud of his ability to align health insurance planning with his clients' unique long-term needs and outlook, and to clarify complex issues. He is committed to open communication and strong relationships for the individuals, families, and businesses he helps. Mark belongs to the Fairfield BNI. Before we start, I would just like to let you know that because of a scheduling conflict, we have to end this session at 6:55. And some other housekeeping tasks for you. To make the speakers appear full screen, go to the upper right-hand corner of your screen and click on Speaker View. Also, during the talk, please enter questions in the chat box at the bottom of the screen. For all upcoming programs at the Westport Library, please check our website, westportlibrary.org. Our next business program will be on Tuesday, November 17th, and the subject will be tax planning in 2020. And now it is my pleasure to welcome Mark and Curtis Bentley of Health Directions.
Thank you very much, Ellen. Hello, everybody. Welcome to our presentation tonight. My name is Mark Bentley. I'm in the dark blue, and Curtis, my identical twin brother, is wearing light blue tonight. So we want to thank the Westport Library for hosting this event, and we want to gear this talk tonight to anyone turning 65 or anyone over age 65 and new to Medicare. And we will present our digital Medicare brochure on how you can get set up under the Medicare program. I know it's short, it's 55 minutes, so we're going to go through the brochure, hopefully not too fast, and then we're going to leave 10 minutes to answer questions that you may have. And feel free to send those questions in through the chat box, and we can answer those during the conversation. Okay, so I'm going to flip the page, and we're going to go into the brochure. Hopefully this is nice and clear for everybody. Okay. So basically there are two options for people when they are first eligible for the Medicare program. One option would be for somebody who is turning 65. Okay. They would have to decide if Medicare is their best option, or if somebody is over 65 and they are still working, they could decide to stay on their employer coverage. But under option number one, this would be for an individual that is new, turning 65, and eligible for Medicare. So they're going to fall under option number one.
Mark, I do not see the screen. That screen's not showing up.
Okay, the screen's not showing up. Hold on.
You gotta click share.
Sorry about that. Okay, can you see the screen now? Good. All right, so back to option number one. This will be an individual who is new to Medicare. They're going to be turning 65. So they can sign up for Medicare 3 months prior, not including their birthday month, for the Medicare program. And this brochure will walk you through the steps on how to do that. Now with the COVID environment we're in, the easiest way to sign up is online. And it's an application that takes about 10 minutes. And right here is a link that you would click on to enroll online for the Medicare program. You would click here and then scroll and apply for Medicare. And you would create your Social Security account and complete the Medicare enrollment process. Now we also have a link with the instructions that you can print out that you can use as a guide to complete the online enrollment. And that's this second link right here. This chart down below is explaining the period for you to enroll. So you have a 3-month window before your 65th birthday to complete your Medicare online enrollment. Not including your birthday month, you also have 3 months after to complete your Medicare online enrollment. And once you complete the enrollment, you will get a notification from Medicare that they received your application and it's getting processed. After that, in 2 weeks, you're going to get this card. It's the Medicare health insurance card, which will be your card you use when you start your Medicare coverage on your first day of your month that your birthday is. Now, option number 2, actually, let me just come back here. If somebody is already taking Social Security, they do not have to enroll online. Medicare will automatically enroll you into Medicare. So they will send out a card to the individual 3 months prior to their 65th birthday. Now, some people do continue to work after age 65. They do not have to sign up for Medicare. They can stay on their employer plan. Now, if the company has 20 or fewer employees, they do have to sign up for Medicare. If there's more than 20 employees, you can stay on the employer plan and opt into Medicare at a later date. And that will be option number 2, which is over here. So there are a lot of people over age 65 still working, and at some point they will want to retire, and they can activate their Medicare coverage under what's called a special enrollment period. And under that period, you will have to get your employer to fill out a form that you were covered and that your coverage is ending. And then you will also have to complete the individual enrollment form. And the forms are under the links right here. This is the employer form, and they fill out a section on that form and put the dates that you were covered. And that form will come back to the individual. And then the individual will also fill out this individual form. And the two forms will get faxed in to the local Social Security office. And the way you find your local Social Security office is under this link right here. And you can plug in your zip code and your local Social Security office will show up with the contact number and the fax number to send in the form. Now, anybody who's going through this step the first time, it's a little complicated, and we always walk through the different steps with individuals, and we can do the same for anyone who has questions on how to get started, either if they're turning 65 or if somebody was coming off an employer plan and they were activating their coverage after age 65. All right, so what happens after you complete the enrollment? So I'm going to move this. I'm sorry if I'm going a little fast. I just want to make sure we cover everything. So what will happen after the enrollment is completed by the Social Security office, you're going to get the red, white, and blue card. And Medicare is broken up into different parts. On the card, you're going to see Medicare Part A, which is your hospital coverage, and Medicare Part A provides inpatient hospital benefits, skilled nursing, home health care, and hospice care. There is no charge for Medicare Part A. You actually paid into the system while you were working. That Medicare tax deduction was for Medicare Part A. Medicare Part B is your medical coverage, and this is all your coverage outside of a hospital setting. It would be for doctor visits, any testing somebody might be getting done. That could be lab work, MRIs, CAT scans, diagnostics, outpatient surgery, emergency room care, home health care, and preventive care. Medicare Part B does have a monthly cost. And the standard cost for Medicare Part B in 2020 is $144.60 a month. And that cost will get billed to an individual if they are not taking Social Security, or if somebody is on Social Security, they automatically deduct the Medicare Part B charge from your Social Security check. Medicare Part C is a form of Medicare coverage, which we will discuss later on in the program. And then the fourth and final part of the Medicare program is Medicare Part D. That is your prescription drug coverage to help people with their prescription costs. So those are the key parts to Medicare: your hospital Part A, your medical Part B. Medicare Part C provides a form of coverage, and then Medicare Part D is your prescription drug coverage. Now, Medicare does not cover everything. Medicare has deductibles and co-insurance that people are responsible for. And let me just show you those costs real quick. I'm going to move this over here, and you can come back to this link and look at these costs. Let me click on this, and then I want to just change my screen share. Can you see that? The Medicare cost at a glance? Good. All right. So here in 2020, under Medicare Part A, there's a hospital deductible. So if somebody only had the red, white, and blue card and nothing else, and they ended up in the hospital for a 1-night stay or a 10-night stay, they would be responsible for this $1,408 deductible. God forbid it's a serious condition, serious accident, and somebody was in the hospital beyond 60 days, this per day charge would start, and it's $352 a day for the next 60 days. That doesn't happen. That's very rare. And if there was a situation like that and you went beyond 90 days, then you would go into your reserve days where your cost would increase to $704 a day. And then Medicare will provide an additional 60 days of coverage. And beyond that, there's no more Medicare hospital coverage. But that's very rare. Now here is the Medicare Part B charge. In 2020, it's $144.60. And the way the government determines that charge, it's based on your prior 2-year income. So anybody enrolled in Medicare in 2020, they are looking at all the 2018 tax returns. So they have brackets. Let me just scroll down here to determine the Medicare Part B cost. And I'll click on this. And this is the chart with the brackets. So an individual who had a modified adjusted gross income of $87,000 or below on their individual tax return will pay this $144.60. If it's a couple and they file a joint tax return and the modified adjusted gross income on the 2018 tax return was $174,000 or below, they also pay the $144.60. Now, if somebody is in the higher bracket, depending which bracket, they will pay a increased Part B charge. And the highest bracket is this one, and that would be the most that somebody would ever be responsible for under a higher income bracket. Now, they also make you pay more on the prescription program because of a higher income. And those brackets, let me just go down here. Are right here. So if you happen to fall in one of the higher income brackets, you will pay more for your prescription drug coverage as well. But if it's someone under the standard bracket, there's no surcharge. So those are costs under Medicare. Now, back to Medicare Part B, which is your medical coverage under Medicare. There's a separate deductible. For 2020, it's $198. So if somebody only had Medicare as their only coverage and they went to a doctor or had to get a test, they would be responsible for the first $198. And after that, Medicare will kick in and they pay 80% of any Medicare Part B service, and an individual would be responsible for all the 20%. There's no stop limit on that amount. So in that situation, you can get additional coverage under the Medicare program. And there's 2 ways to get coverage set up under Medicare. One option is over here where the arrow is pointing to original Medicare, Part A, Part B. Those 2 boxes are the Medicare card over here. Under this scenario, you will use the red, white, and blue card, and Medicare is the primary. And when Medicare is the primary, you have an open network where you can go to any doctor, any hospital, anywhere where Medicare is accepted in the United States. With that setup, you would add a prescription drug plan under step 2. You're not required to add a prescription drug plan. They give you a time frame to enroll in one. If you opt out and decide to get a prescription drug plan down the road, they will tack on a penalty. And that's determined by how long you went without coverage. Under step 3, people can add what's called a Medicare supplement plan, also known as Medigap. And Medicare supplement plans will pick up the Medicare out-of-pocket deductibles and coinsurance, depending on the plan, will have different levels of benefits and different costs. And I'll show you those shortly. The other option for individuals to set up their Medicare coverage is a program called Medicare Advantage. So anybody who's watching TV today, that's all you see are Medicare Advantage ads. And what Medicare Advantage is, it's a private insurance company providing your Medicare Part A, your Medicare Part B, and your prescription drug coverage all under one plan. So Medicare outsources to the private insurance sector. So it could be a company like Aetna or Anthem or United Healthcare, and they provide any service you are entitled to under the Medicare program. This option is more like an employer plan that you might be coming off under a job. You're going to pay different co-pays for different services only at the time of the service. For example, a primary care visit might be a $5 copay, depending on the plan and the structure, and that's all you would pay. A specialist visit could be between $40 and $50. Now, companies price these plans at very attractive rates. A lot of these plans have a 0 monthly cost. And everyone asks, how can that be? Well, Medicare sends the private insurance companies a set dollar amount every month for each member that they have. And the insurance company uses those dollars to pay your claims. And they also provide extras under the Advantage program that you're not going to get under original Medicare. And the extras are dental, depending on the company. There's hearing aid benefits and vision benefits. So the Advantage program is very attractive to a lot of people. And what we find, it seems to be a 50-50 split the way people get their coverage. People either sign up under original Medicare or they sign up under the Medicare Advantage program. And the best way to decide is how you use the medical system. Somebody who might not use the medical system a lot, they might be having a couple of doctor visits a year, they tend to like the Medicare Advantage program, especially the 0 cost. Someone who could be dealing with some health issues, they tend to gravitate towards the original Medicare side. So let me show you some supplement plan options where you could get these out-of-pocket costs under Medicare covered. And I'll just go through 3 different options. Let me make this a little bigger. All right. So here in Connecticut, anyone new to Medicare, if they wanted the best supplement plan, it would be Medicare Supplement Plan G. And Medicare Supplement Plan G helps with the cost under Part A that somebody would normally be responsible for. So all the costs in this column would be covered by Medicare Supplement Plan G. You would not pay any of these charges. The Medicare Supplement Plan G would pick up all those out-of-pocket costs. So that's excellent coverage for anybody who's an inpatient in the hospital or needs skilled nursing care. However, on the B side, this is your coverage under Medicare for services outside of the hospital. The Medicare Supplement Plan G covers all out-of-pocket expenses except the Medicare Part B $198 deductible. That would be the individual responsibility. After the 198, all the 20% that Medicare is not covered, this plan would pick up 100%. And all other costs under Medicare Part B. So your only exposure is under this plan is $198. So it's a great plan. We call it the Cadillac Rolls-Royce. Anybody who had a lot of chronic health conditions, this would be a great plan for someone in that situation. Now, a middle of the road plan would be this next plan. This is Medicare Supplement Plan N. And under the Part A side of Medicare, it's the exact same coverage as the G we just looked at. All the out-of-pocket costs under Part A, under this column, would be covered under the Plan N. The exact same coverage. Under Medicare Part B, this is where we find most of the people are using their Medicare coverage. There's a slight difference. Just like the Medicare Plan G, you have to pay the $198 deductible. And the biggest difference here is for a doctor visit, you would be responsible for a charge of up to $20 at the most. That could be a primary care doctor or a specialist. And you also have a $50 copay for the emergency room. Outside of a doctor's office visit or the ER, any testing, any outpatient surgeries, diagnostics, they would be covered 100% after the $198 deductible. Very good plan, priced at a reasonable rate. And we have a lot of clients that like that as an option. And then this next option would be the lowest cost plan that somebody can get. And it is a variation on the first plan we looked at. It's a Medicare Supplement Plan G with a deductible. They call it the high deductible Plan G. So the way that Plan G is structured, G, there's a $2,340 deductible. It's not an upfront deductible because under Medicare, you only have to cover the Medicare out-of-pocket cost. So for example, if somebody was in the hospital and they had a 1-night stay or a 10-night stay, their responsibility would only be this hospital deductible, which is the $1,408. That deductible would go towards this $2,340. So any out-of-pocket cost under A or Medicare Part B, which would be the Part B deductible and the 20%, if they were to total $2,340, then an individual would stop paying. They would be covered 100% after that. And that plan is very reasonable. It's $50 a month. Okay, so just looking at the clock here. This chart tells you about the prescription drug program. This is Medicare Part D. So the Part D program is a little confusing when you first hear about it. What the government did, they set up a standardized prescription drug plan that all the companies use to design their plans. And the standardized prescription drug plan has 4 stages. So right now, in stage 1, under the standardized plan, there's a deductible. It's $435. So that would mean you would be responsible for the first $435 of your prescription drugs. Now, companies can only charge that deductible for generic drugs, or they can design a plan where there's no deductible for any prescriptions. But after stage 1, an individual would move into stage 2. And in this stage, you would start paying a copay for the type of medication you're taking. So if it was a generic tier 1 medication, the copays are going to be very low. Plans are not even charging for tier 1 medications, 0 copay. Tier 2 generics, copays are going to be low, under $10 in that range. The brand drugs, that's when your copays are higher because the retail costs for brand drugs are higher. And the way it would work in stage 2, if somebody was taking a brand drug, and let's say the retail cost of that brand drug was $100 and the copay for that medication was $25, you would pay the $25 and the insurance plan would pick up the difference between the retail price of $100 and $25, so they would pay the other $75. And what you pay in copays and the insurance company's picking up in cost, if it were to total $4,020, people would move into stage 3. It's called the gap. It used to be called the donut hole. And in this stage, your costs are going to go up. You're going to pay 25% of the cost of all medications. So anybody who's taking a brand drug, I don't know if you see those ads on TV. A lot of those ads are for brand medications and they're quite pricey. They could be in the $400 to $500 range. So in this stage, if you're paying 25% of the cost, your prices are going to start going up. And to get to the last stage, the total out-of-pocket cost that you pay during stage 1, stage 2, stage 3, and the insurance company's cost were to reach $6,350, people move into the final stage called the catastrophic. And here your costs go way down. Now, not many people get to this stage. You have to be taking a lot of medications, and most of the time you're taking brand medications, and that will move you to this stage. And under this stage, brand drugs would only cost $8.95 or 5%, whatever's greater, and generic drugs would be $3.60. So it's a little complicated if this is new. We search all the medications, all the formularies, and based on the pharmacy you use, and help people find the best plan based on their prescriptions. And there are a lot of different choices. And right now we're in what's called the annual election period. So anybody on the Medicare program can review their plans and make a change. And that's always October 15th to December 7th. So prescriptions can cause a lot of changes in people's plans. So I'm going to move on to the next page here. This page will describe the Medicare Advantage program. And it also tells you the enrollment periods for getting Medicare Advantage plans, how the plans work. I'm not going to go through this whole page, but you can click on this link after and just come back to this page and get more information about the Medicare Advantage program. And on these next pages, we have some side-by-side comparisons between original Medicare and Medicare Advantage plans. So the biggest difference is going to be the cost and the extras. So Medicare Advantage is going to give you the extra benefits that I mentioned before. That would be your dental, vision, and hearing aid coverage. Whereas under original Medicare, you're not going to get any dental, any vision. That would be a routine vision exam. And they also don't offer any coverage towards hearing aids. And hearing aids can be quite expensive. So this just gives you a little side-by-side comparison. And we also put together some videos of Medicare that you could click on to help you understand the different parts of Medicare. Feel free to come back to this. And you can get information about Medicare Parts A and B, Medicare Advantage, and just Medicare in general. So I'm going to move on. Okay. Here in the state of Connecticut, there's assistance available to people under the Medicare program, and the program's called a Medicare Savings. And the assistance is based on somebody's monthly income. It has nothing to do with their assets. And this chart will show you the different income levels if somebody was single and the programs that they could qualify for. This would be the best program. It's called QMB, which stands for Qualified Medicare Beneficiary. To be eligible for this program, if somebody had a monthly income of $2,245 or below, that program will assist with the Medicare Part B charge, which is the $144.60. It actually goes back into your Social Security check if you're on Social Security, or you won't pay it under Medicare. And they also help with the Medicare out-of-pocket costs, the deductibles, the co-insurance that Medicare doesn't cover. So this is an excellent program. A lot of seniors don't know about it. We always explain it, and there's different income levels. This is your next bracket, 2,457, and then they have one more bracket, 2,617. These are all for single individuals, has nothing to do with assets. It's strictly based on income. And then if it was a couple applying together, the brackets would be right here. We have an application for this program attached, which would be on the next following pages. It's a real simple application. We could help anybody who thought they might be eligible for this, complete this form and send it in. It's only 4 pages, just name, address. On this page, marital status. And then on this page, you're going to put your medical coverage up here, and then you put your income down here. Then you just list it and then mail in the application, and they will give you an award letter notice to see if you are eligible. And if you do become eligible, there's certain medical plans that can work with this program, and we would be more than happy to discuss it further with anyone if you thought there was a chance you could qualify. So I'm going to click through here. This is our contact sheet. So if anybody has any questions and they want to contact us, please fill this out. What we do, we check the medications for everybody. We check all the doctors in the different plans and make sure your doctors would be participating and in network. So we would ask someone to list them there. And then over here, any medications you're taking, please list on this page, dosage and quantity. And we would be able to research all the prescription plans and help you find a plan that suits your needs. And then on this last page, we have a link. Let me make this a little bigger. So we have a lot of helpful links here that people can come to and just click and get additional information. We have the applications to get signed up for Medicare over here as well. This would be the employer form. Actually, the employer form's right here. Somebody could click on it, print it out, and get that form to their employer. Then the employer would get that back to you. We got the cost. This explains the late enrollment penalty for prescription drug coverage. So very helpful resources here. Please take advantage of it. And then on this last page, if anyone wanted to get additional plan information, they could come down here. Oops, let me make this a little bigger. And they could click on one of these links. Let's click on this one. And under this link, you could plug in your zip code, just to give you an example. And you can view all the Medicare Advantage plans in the state of Connecticut, all the features. prescription drug plans, and Medicare supplement plans. So just to give you, these would be all the different programs under the Advantage plan that you could do a certain carrier. So feel free to click on the link and do some exploring, and I'm sure you're going to generate questions. I know we're running close to 6:45, so if anybody has any questions, we can answer those now. And Curtis can answer the questions. Okay. We got a couple of questions through the chat. Some people were asking about Medicare Advantage plans. Do they function as an HMO provider network? And the answer is yes. Some of the Medicare Advantage carriers do offer HMO networks, and those are networks where you have to see the doctors that participate in the network. Now, there's a lot of plans offering what are called PPO networks, which are preferred provider organizations, where you do have the option to see in-network contracted doctors that participate in the plan, and you could go out of network. When you go out of network with those plans, you're going to have higher cost share. The plan's going to charge you more cost sharing. So we like to search the provider networks to make sure your doctors are in the network, especially with the Medicare Advantage plans, because that's how you're going to have your lowest out-of-pocket cost. Another question we got, can you switch plans during the year? And the answer is only during certain times. So Medicare has what's called the annual election period, which we're actually in right now. And that's the time of year where existing Medicare members can make a plan change, evaluate their options for the upcoming year. And that period runs October 15th through December 7th. So every year the plans make little tweaks to their drug formularies. They may make changes to the Medicare Advantage plans, the cost shares. They may make some updates to the network. They send out notices letting you know what these changes are. And then we can help you evaluate, does it make sense to keep the plan you're in? Does it make sense to switch to a different plan? You can switch from the Medicare Advantage side, go back to original Medicare. You can go from original Medicare back over to Medicare Advantage. So there's a lot of options. And the best part is you're not locked into one side your whole Medicare life. We can take some voice questions if anybody wants to ask a question if we're set up for that. Let me see if we have any additional questions. Yes, we can send out the link for our Health Directions homepage and for this brochure, how to get started with Medicare brochure. Yes, we will email this brochure. It's all electronic, so it's just a link. So it's very portable. Let me see. I have an Advantage plan now. Can I switch to Medicare and Medigap now? Yes, this is the time period to evaluate your current Medicare Advantage plan. Look at the Medicare supplement plans, the standalone prescription drug plans. So that period runs now, October 15th through December 7th. And if you miss that period, there's one other enrollment period, and this is only for people that have Medicare Advantage plans. And that enrollment period is called the open enrollment period. And that runs January 1st through March 31st. And that period, people that are on a Medicare Advantage plan could disenroll from a Medicare Advantage plan and go to the original Medicare side and sign up and set up a Medicare supplement plan and a prescription drug plan. So it's one extra enrollment period just for people that are on Medicare Advantage, not if you have a prescription drug plan. Let's see if there are any more questions. One new message. I turned 65 in March. When should I contact you to help me analyze the best plan for me? Good question. So you are approaching what's called your initial enrollment stage. And that's the 7-month window that runs 3 months before the month you turn 65 and 3 months after the month you turn 65. So because you're turning 65 in March, your Medicare coverage is eligible to start March 1st. So you can start looking in December, January, no. Yeah, December. So December, you can get signed up for Medicare, get enrolled into the Medicare system through those, through the online Social Security Administration website. We recommend people definitely do it 3 months before the month you turn 65, because if you wait after the month you turn 65, they delay your Medicare Part B effective date. So it could be delayed by 2 months, 3 months. So you definitely want to get everything set up 3 months prior, before the month you turn 65. Oh, Carrie just posted the link to the brochure, and you can copy that from the post that she just made. So that's a very helpful tool. We update that every year, and it helps people, especially new to Medicare, because when you're approaching age 65, you're getting bombarded in your mailbox with all the different carriers mailing information about their plans. Some of the advertisements are very sneaky. They look like they're coming from Medicare. Next thing you know, you're calling some phone bank area and people get your phone number and they just call and never stop. So we're a local resource here based in Fairfield. We've helped hundreds and hundreds of people transition into Medicare. We have an office downtown Fairfield, and with today's technology, we can meet remotely via Zoom, over the phone. We're also doing appointments in our office, practicing wearing a mask and being safe. Let me see here, any other questions? I think, let me see. Oop. So we're getting close. We have 5 minutes left. We kind of had to run through this pretty quickly. So it was a lot of information to pack in 45 minutes. So if anybody wants to call us, we can schedule an appointment and help you get a better understanding how to get set up for Medicare, what your different options are. We don't charge anything for our services. And it's really, it can be confusing, but once you get into the Medicare program, it really is a great program. And about 60 million people are covered under Medicare and growing. So it's very important that you follow the enrollment period. If you miss your open enrollment period, your initial enrollment period, you can get charged a penalty. So you have to definitely pay attention when you're approaching age 65. And we can tell you whether you should stay on your employer plan or start Medicare. We can compare the cost under your employer plan with the cost under Medicare and the differences in coverage. Some people like to start Medicare. Some people want to stay on their employer plan. Everybody's different. Now, one thing to be real careful about, if you're over 65 and you're offered COBRA, that is not considered credible coverage under Medicare. So if you have the option of COBRA or going on Medicare, just call us and make sure you're making the right decision. Sometimes people think COBRA is the best option, and then they get stuck with a penalty because they should have enrolled in the Medicare program. So that sometimes happens to people. Okay. All right, well, this was great. Thank you for attending. If anybody wants to give us a ring or call us with additional questions, we're here. We're available during the week. It's our busy time of the year. We have a lot of Medicare clients, and we have a lot of people that think of us as their Medicare HR department. Because when you leave the employer coverage, you don't have the HR person to go to, you're basically on your own. So count us as a resource. We're local, and we'd love to help you any way we can. I think that's it. Anything else, Curtis?
No. Ellen, do you have to do anything or?
Because they gotta.
Thank you both for giving us this great overview of Medicare this evening. We're very thankful that you were able to give this program at the Westport Library. It was very comprehensive, and we appreciate your coming here this evening. And so that's it, everybody. Thank you all for coming and listening to this great program on Medicare. If you've got any questions or you know how to direct them directly to Curtis and Mark, you have the link to the brochure that Kerry put up, and that's it. So thank you all for coming this evening, and please go to the Westport Library site, westportlibrary.org, for all the other wonderful programs that we are giving virtually this year. Thank you very much, and good night.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye.